Hello. So I had Project 39, and the first question was describe what consumer-driven health plans are and how they impact health service reimbursement and health insurance expectations. So consumer-driven health plans is defined as a health plan designed to allow the employee greater choice in their health care, thus enabling them to be a wise consumer. How do they impact health service reimbursement? So the services offered will be services that the patient can actually pay for, and until the service care is paid for, it's normally pushed back or um, at a time when they are able to do that, as opposed to the way it is now, where some hospitals can even take advantage of the system and put services they have supposedly done, even though they have not done it, just to receive more back to the hospital. Basically, taking advantage of the reimbursement policy. How they impact health insurance expectations. So, health insurance usually has a big impact on the decision-making process in regards to your health care. They are in control of what services they will and will not cover. However, by allowing consumer-driven health plans, they are giving the opportunity for the consumer to be more in control. The consumer can then choose what they want to include and set money aside for it. Then the second question is describe what high deductible health plans are and how they impact healthcare service reimbursement and health insurance expectations. So the definition for that is a type of consumer-driven health plan that offers a broad provider network, limited involvement, and with medical management, higher deductible, and lower premiums. How they impact health service reimbursement. So I basically said a little bit of the similar thing on the first slide. The hospital has the less likelihood of falsely stating services that were not done. How they impact health insurance expectations. So high deductible health plans focuses on the premise that health insurance should function similarly to other forms of insurance, specifically covering high costs, unpredicted, and catastrophic health needs. However, these plans do not cover everything, which is an expectation that many consumers assume, considering that it is not a typical health insurance plan. Do you believe that consumer-driven health plans and high-deductible health plans contribute to increased quality of care and fewer medical errors? Why or why not? So I said yes, I think it does, because consumer is in charge of the services used and covered. For this reason, the physician will be administering tests and treatments that the patient is on board with. Also, since the patient is paying, the hospital will be more inclined to focus on the patient and their overall experience as they are dealing with the patient in regards to payment, as opposed to an insurance company. Thus, this will result in more caution and better quality since the patient is the one paying directly. So instead of the hospital dealing with the payment with an insurance provider or company, they're having more of a one-on-one with a patient, in terms of the payment. So I feel like the physician and the hospital would be more inclined to really focusing on the quality of care and being as cautious as possible, since the payment process is a lot more directly with the patient. So those are just some factors that I would assume they would consider if they are dealing with patients with this type of insurance. Discuss the role of consumerism in health management. So the definition of consumerism is actually a social and economic order that is based on the systematic creation and fostering of a desire to purchase goods or services in even greater amounts. The role of the consumerism, it's actually by Halvin, McAllister, and Slavin referred consumerism in healthcare as more of a strategy that encourages and enables personal health through these four components, which are knowledge of their current status and needs, informed decision-making, wise use of healthcare dollars, and confident active participation in their own healthcare decisions and treatment choice. And then the final question was, do you believe that consumers accept responsibility to their health? Discuss why you believe that. Yes, I think the consumers should always accept responsibility for their health. By choosing one of these plans, they're allowing for more control and involvement in their healthcare. Even with other insurance options, the consumer is the person who is in control of their health. Doctors can provide suggestions and treatment, but if the patient does not take responsibility and follow these procedures, then they will not live a healthy and active life. So ultimately, the patient is always in control of what they decide to do with their health. So a physician or doctor will always, give you suggestions, give you different treatment options, whatever it may be to help you live a healthier and active lifestyle. However, it is really in the patient's hands and responsibility whether they implement it or they decide to take these responsibilities into their own hands and actually, do them. So I think, it really is, I do believe that the consumer accepts the responsibility. Ultimately, they are the only person that can change or better themselves. The doctor can only do so much from his position, and he's not there by your side continuously reminding you to take your medication or whatever it may be. The patient is always going to have to overcome different obstacles and determine, okay, if my health is more important or not. And at that point, they really are the person that's going to impact whether the outcome of the treatment or whether their lifestyle is healthy is going to, how it's going to unfold over time. And they're the only person that can really determine that. And that is it. So thank you.